Our next session is another organisation that we are so pleased to have such a wonderful working relationship with, and that is Epilepsy WA. It is a community group. They receive, well, let's say no public funding. I think they've received a small grant recently. But the value of the work they do is incredible, and they're relied on by the health department and all the physicians within hospitals. So I'd like to welcome Paulette Kemp to the stage. She'll be talking on the value of community-based epilepsy education and support. So Paulette is traditionally a pharmaceutical professional with expertise across sales, marketing, management and liaison roles with various therapeutic areas including rheumatology, neuroscience, oncology and haematology. In 2022, she joined Epilepsy WA as the Epilepsy Smart Manager for Western Australia. Her role involves increasing knowledge and awareness about epilepsy, providing training on seizures, first aid, understanding epilepsy, administering emergency medication and promoting seizure alert devices offered by Epilepsy WA. Her goal is to shed light on epilepsy and educate individuals with a duty of care in Western Australia. Please welcome Paulette Kemp.
Thank you very much. So we pay respect to the traditional owners of the land and elders, past, present and future. We also want to say thank you, ETA and the Neurology Council for putting this meeting together and for inviting us to be here. Yes, so one thing when I started at Epilepsy WA and Emma, our CEO, told me that my job title would be Epilepsy Smart Manager. We are having a few private jokes at home because I tell my husband, I always told you I'm smart. Now I've got the job title. But yes, so it's education and training and most of what I do for work is educating non-healthcare professionals in the education sector, aged care sector and disability sector how to support people living with epilepsy. The one thing that I think you have heard quite a bit today, the words stigma, and I'm going to talk about it again today regarding people living with epilepsy. Now, 1 in 25 people live with epilepsy, so way more than I think what would be that we would think about or that we would consider the number to be. And the reason for that is specifically the stigma and the fact that people are sometimes so scared of being ridiculed and discriminated against that they won't disclose their epilepsy to anybody. And that is what we want to change. So we want to change, and we want to change the mindset or the wording from awareness, being epilepsy aware, to being epilepsy smart. If you think of awareness, everyone knows epilepsy exists, so they're epilepsy aware. But there are so many misconceptions, mistruths, myths out there. So what we would love to do at Epilepsy WA is make an entire community, our entire WA community, epilepsy smart. So I am going to talk a bit about what is epilepsy, and I do realize that there's a lot of health professionals in the room or allied health professionals that already know what I'm talking about. So serious neurological condition characterized by recurrent seizures. 1 in 10 people in their lifetime will experience a seizure. So that is one of the reasons why we put so much emphasis on seizure first aid and what to do if you witness someone having a seizure. That 1 in 10 would be a once-off seizure in their lifetime. 1 in 25 would then go on and have recurrent unprovoked seizures and get diagnosed with epilepsy. And a seizure is a disruption of the electrical activity in your brain, and can have lots and lots of symptoms. So it can affect thoughts, it can affect feelings, movements, confusion, state of consciousness. It can result in convulsions, but doesn't necessarily. Epilepsy does not discriminate. People with epilepsy are discriminated against, but epilepsy does not discriminate any age, any gender, ethnicity, ability, IQ, does not discriminate at all. And in over 50% of people, or close to 50% of people, the cause of their epilepsy is unknown. You'll see us talk about the 1 in 25 quite often. In October, we have the Walk for Epilepsy from the 1st to the 25th of October, so that we can make people aware of how common this condition is. In WA, we have approximately 1,500 new cases a year. For 30% of those people, they do not achieve seizure freedom with medication. So you have heard earlier today the very long wait lists just to get to see a neurologist. So you can imagine the journey of someone living with epilepsy, first presenting with something that people wouldn't necessarily identify as seizures, and then having to go through the very, very long route of getting diagnosed and treated with medication, and then 70% of people are seizure-free on their medication, which is, or can achieve seizure freedom, which is fantastic. Mental health conditions, so anxiety and depression is experienced in about 50% of in people living with epilepsy. And premature mortality is 3 times higher in people living with epilepsy. And I'll touch on that a bit more as to why that is the case. And it is because of their, a seizure can happen anytime, anywhere. It can happen in water, it can happen on public transport. And that is where people living with epilepsy can be exposed to risk and harm. And that is also where part of talking about educating the community comes in, because quite often it can be misinterpreted as intoxication or maybe drug effect. It's not necessarily, if you witness someone having a strange behavior on public transport, you might not necessarily always think he's having a seizure. And that's one of the things that we want to change. We want it to be more top of mind in everybody's. So yes, so injury, risk of injury, drowning, burns, car accidents, losing their driver's license, the 3 times higher risk of premature death, also the sudden, so in epilepsy you get sudden and unexplained death in epilepsy. And that's 27 times higher in people with tonic-clonic seizures, so the high risk there. The mental health conditions, the direct and indirect costs, people with epilepsy also have got reduced prospects of completing their education, completing a higher education, sustaining relationships, sustaining employment, and then obtaining a driver's license. So you could, those impacts have got very wide impact on the entire family and the entire support network, because you can imagine losing your independence when you're not able to drive and always having to be reliant on someone else if you need to get somewhere, so all the impacts. What the feedback that we are getting from people living with epilepsy is that the stigma and discrimination to them is often worse than the disorder itself. They are quite often ridiculed and they are quite often ignored when medical assistance is required. One example, we have got a lovely volunteer counsellor who lives with epilepsy herself, and she had a tonic-clonic seizure in Claremont Quarter, someone ran to get the defibrillator. So, and that was coming from a good place and actually trying to help. But we got a phone call from a student who is studying to be a teacher, and one of the lecturers said to her, "You won't be a good teacher because if you have a seizure in front of your class, you will traumatize the kids." So that's the kind of things that people living with epilepsy is going through on a daily basis. So, and I think I may have put the sentence at the end again, the very important thing for us is to understand epilepsy as a medical condition and not an evil, contagious plague. So in some countries and in some cultures, there's even a lot more misbeliefs when it comes to epilepsy. We as an entire community can make a difference, because if we are epilepsy smart and we see something happening next to the road, to not just assume that it is someone being intoxicated, but to maybe have a brief thought of, could this person be having a seizure? Should I maybe just check if they're okay, or if they're wearing a medical alert bracelet before I just move along? A lot of this morning's talks were about governments and policymakers and healthcare funders and the role that they can play. And I think that's my next slide. I'm definitely not going into that graphic. But so there's a lot of the top end of town that need to help us close that gap. But us as the community, we are the neighbors, we are the shoppers, we are the people that use public transport. We can start even from our end to become epilepsy smart and to try and close that gap. I do have a case study, so some of the IGAP literature that came out, specifically published a case study from India. So it was a 3-year program funded by the Indian Council of Medical Research in Delhi, and they realized that records of government-run schools showed that the rate of diagnosis of epilepsy was below the statistical average. And it was because of strong stigmatization by communities that the symptoms of epilepsy in children may have been underreported by parents and teachers, because quite often children with symptoms may not be allowed to attend school. So this Indian Council of Medical Research then decided improving the knowledge of teachers and health workers about epilepsy was a very important initiative for them. So they still have to publish their results afterwards. I have got a few other results published in other countries stating just how that gap was closed through community education. So quite often it would be educators and the police, if they can get a better understanding of seizures and people living with epilepsy. In Myanmar, the epilepsy initiative, the activities increased community coverage from 2% to 47%, so the understanding of epilepsy with pre and post questionnaires. And in Mozambique, having a population of over 2 million, same initiative, and they also included their psychiatry technicians in educating about epilepsy as well. What we have found doing community education, information replaces fear, information empowers people. Access to the information helps people to identify the potential risks that could be in their house or their day-to-day living. It helps them identify their triggers and teaches them to avoid them. People living with epilepsy and their families should all know seizure first aid. Yes, manage their safety risks and their triggers. So this improves the quality of life for people, not only the people living with epilepsy, but their families and loved ones as well. And in the end, the indirect costs that we have of people maybe not being to sustain a job or things like that will be changed. Our impact report from last year, we're currently working on our one for the new financial year. So we are committed to providing essential services, support services to improve the quality of life of people living with epilepsy and their affected families and caregivers, and to increase community awareness and understanding of the chronic neurological disorder. And our vision is that West Australians with epilepsy will live without fear and discrimination and have improved health outcomes. So we provide a wide array of statewide support, information, education, advocacy, and community engagement services. We have on our website links to free webinars presented by prominent epileptologists in WA. We have the largest seizure alert display in the country. We have free loan programs of some of our seizure alert technology. So we did bring some of that with us today. I'm talking about educating the education sector. So I talk a lot with teachers and principals. And you'll notice one of the devices we have on our table is a head with a little band around the head. So that is to detect absence seizures. So it comes with a phone that lights up and then warns the teacher. So instead of the teacher thinking that little Johnny is daydreaming or not paying attention, the teacher is being made aware that for 3 seconds, little Johnny is having an absence seizure. So that's the type of technology that we have. So we would love to share more information about that. We've got a seizure fact sheet that you can download just with a QR code. So please pop by and scan the code. Yes, as I said, publications, seminars, online activities, support groups, and we have a national information line. And yes, I would really like to finish with this, this quote again that was from one of the papers after IGAP, saying that people need to understand epilepsy as a medical condition, not an evil contagious plague, and for people to live dignified lives. And thank you so much for your time. These were my references, and if you ever need any information or need to reach out to us, please contact us via our website or our phone number. Thank you so much.
Thank you so much, Paulette. That was excellent. And you can see the amazing amount of work that is done solely through the efforts of an organisation who engages in fundraising to support all of that. And if Epilepsy WA wasn't here to do the work that they did, I think we would all be in a lot of trouble in WA. So congratulations and thank you again to Paulette and to Emma and to the Epilepsy WA team.